The patient is our reason for existing.
Dr. Bruce, telephone, please. Dr. Bruce, telephone, please.
We pledge never to lessen our efforts to help the sick and needy. Never to lessen our concern for the dignity of every patient we serve. And never to relax our standards of excellence for patient care.
The Beth Israel Medical Center family proudly celebrates a century of service. A tradition begun on the Lower East Side 100 years ago to provide the highest quality of medical care with concern and compassion for each patient. We owe an enormous debt of gratitude to those who have gone before us, those whose vision, talent, and philanthropy have brought us to the Beth Israel of today. And with all our high technology and state-of-the-art medical care, we have never forgotten our obligation, our commitment to reach out to those whose needs are greatest. As we begin our second century of service, we rededicate ourselves to our mission, our tradition, and our commitment to caring.
In the last 2 decades of the 19th century, the flood of European immigration was at its height. On the Lower East Side of Manhattan, the Jewish community crowded into slums and dark, airless sweatshops. These conditions led to sickness and infirmity. Medical care and hospital service were unattainable luxuries. A meeting was called in December of 1889. Subscriptions were raised, and Beth Israel was born. These early philanthropists saw the need and had a vision. By the summer of 1890, a dispensary opened on Henry Street. But outpatient care was not enough. And in 1891, Beth Israel became a 20-bed hospital on East Broadway. Providing for the sick poor was a Beth Israel commitment. Property was obtained at Jefferson and Cherry Streets, and in 1902, a modern 115-bed hospital opened its doors to all in need. A school of nursing was established in 1904. The hospital pioneered in social services and outpatient clinics. In 1911, physicians at Beth Israel announced a cure for trachoma, an eye disease that had prevented many hopeful immigrants from entering this land. This commitment to social responsibility and a dedication to excellent patient care became the Beth Israel tradition. In 1917, the hospital became a charter member of the Federation of Jewish Philanthropies and assisted in the war effort. In 1929, historic Stuyvesant Square saw the opening of the 400-bed Daisian Pavilion on East 16th Street. At the time, the tallest and most modern hospital building in the world. Here, Beth Israel was joined by the Jewish Maternity Hospital, and new research programs were initiated with New York University School of Medicine. After World War II, a new era of expansion and modernization began. A research affiliation was created with the Rockefeller University. And Beth Israel Hospital became Beth Israel Medical Center. In the vanguard of healthcare delivery, the new medical center introduced the pioneering methadone maintenance treatment program for heroin dependency. This program demonstrated for the first time the feasibility of providing effective, large-scale treatment to a rapidly growing addict population. Beth Israel became a major teaching institution and affiliated with the Mount Sinai School of Medicine. All of the center's clinical service directors are full professors at this preeminent school. Beth Israel achieved world renown with the application of the endoscope for diagnosis and treatment of gastrointestinal diseases. new cardiac and surgical intensive care units were established. And staff physicians were among the first in the country to recognize the symptoms of AIDS. The medical center is expanding its services to an increasingly larger segment of the community. Beth Israel provides a continuum of care, primary to acute to long-term. A multi-institutional health care system with greater flexibility and efficiency. At its historic campus in Lower Manhattan, at its 34th Street building between Park and Madison, providing state-of-the-art ambulatory diagnosis and treatment in a private group practice setting. At Doctors Hospital, a fully modernized 263-bed acute care institution on the Upper East Side. And at its 230-bed nursing home in White Plains. For a century, Beth Israel has grown with the great ever-changing city it serves. What lies ahead in a second century is unknown. But one thing remains clear. Delivering quality health care depends, as it has for a century, on people. Caring people who provide a diversity of quality services that meet the medical and social needs of the communities it serves. Knowledgeable people who are on the leading edge of medicine. Physicians, researchers, teachers, and technicians forming the foundation for the future. Beth Israel is proud of its family. A truly dedicated team. "2,000 physicians and dentists serve throughout the Beth Israel system. Their excellence is central to the strength of the institution. In the fight against cancer, metabolic and neurologic disorders, these professionals employ the latest technology. In radiation oncology, for neonatal care, kidney dialysis, anesthesiology, and male infertility. Beth Israel's non-invasive nuclear cardiology program utilizes the most advanced diagnostic technology. Magnetic resonance imagers and CAT scanners provide detailed internal pictures of the human body, unimagined a few years ago. In the forefront of new technology, Beth Israel is engaged in a research protocol to use the ultrasound waves of biliary lithotripsy to remove gallstones without surgery. Through expansion and renovation of key diagnostic and emergency services, Beth Israel renews a century-old commitment, a tradition of compassionate, quality care. Today, over 1,200 highly trained nurses uphold that tradition. Since early in the century, the Phillips Beth Israel School of Nursing has provided the hospital with a priceless resource. Here also, medical students and physicians in training learn the skills of modern medicine and a heritage of service. Beth Israel has one of the largest postgraduate medical education programs in the city. Beth Israel conducts vital research programs in such fields as metabolic and immunodeficiency disorders, in cardiology, pathology, and neurosurgery. As always, the medical center remains committed to efficient patient care. The administration directs more than 6,000 people who ensure the smooth functioning of complex day-to-day operations. In the kitchen and environmental services, in engineering, security, and medical records. In all areas, these people are an indispensable network of support. Beth Israel has a century-long commitment to social concerns and medical ethics. To face the multifaceted problems associated with substance abuse, AIDS, and mental illness, the Chemical Dependency Institute was established to coordinate efforts to help stem the tide of substance abuse and addiction. And no medical center does more in the care and treatment of AIDS patients. As an initial participant in the clinical trials of AZT, with specialized inpatient units, with the first outpatient facility devoted to AIDS patients, the Peter Kruger Clinic for the treatment of immunological disorders, with significant research projects, and most recently, by acquiring a building on 17th Street to house what will be the first hospital-based intermediate care facility for AIDS patients. Approximately 5,000 babies are born here each year, the second largest obstetric service in Manhattan. Beth Israel Medical Center has one of the largest inpatient and outpatient psychiatric programs of any voluntary hospital in New York City, and is renowned as a leading innovator in the field of psychotherapy. The Jacob Perlow Hospice and its Leo and Rachel Sussman unit provide home and inpatient care, support for the terminally ill and their loved ones. Home care and nursing home facilities respond to the increasing need for alternate levels of care. Patient representatives speak many languages, and social workers are sensitive to the needs of patients and the community. Outreach and health education are provided by the Carpus Health Information Center. For a century, Beth Israel has been nurtured by giving people. The volunteer giving freely of time, 80,000 hours annually of service and assistance. The philanthropist offering invaluable support, keeping Beth Israel financially sound and in the forefront of medical technology. And the trustee, giving knowledge and expertise, a leadership that acknowledges the spirit of the past and recognizes the needs of the future. The spirit of an institution is a reflection of the people who serve there. The personal touch, the cornerstone of patient care. Over the years, many have labored here. Through their generosity of spirit, we have arrived at the end of our first century. Beth Israel Medical Center, sustained by giving, committed to caring, and prepared for a second century of service.
Happy birthday!
Happy birthday, Beth Israel!
Happy birthday, Beth Israel!
Happy birthday!
It's happy.
Happy birthday, Beth Israel!
Happy birthday, Beth Israel!
A very happy birthday, Beth Israel Medical Center.
Feliz cumpleaños, Beth Israel.
Happy birthday, Beth Israel!
Happy birthday, Beth Israel.
Happy birthday, Beth Israel.
Happy birthday, Beth Israel, from the medical students of Mount Sinai.
Happy birthday, Beth Israel.
Happy birthday, Beth Israel!
Happy birthday, Beth Israel.
Happy birthday.
Happy birthday, Beth Israel.
Happy birthday, Beth Israel!
Happy birthday.
Happy birthday.
Happy birthday, Beth Israel.
Happy birthday, Beth Israel! Happy birthday!
Happy birthday.
Happy birthday, Beth Israel.
Happy birthday, Beth Israel.
Happy birthday.
Happy birthday, Beth Israel!
Happy birthday. The happiest of birthdays, Beth Israel.
Happy birthday, Beth Israel.
Happy birthday, Beth Israel.
Happy birthday, Beth Israel. Wow, 100 years. Woo, that's beautiful.
Happy birthday, Beth Israel! Happy birthday, dear Beth Israel!
Happy birthday, Beth Israel!
Happy birthday, Beth